My name is Randy Jones. I'm a professor at the University of Virginia School of Nursing, as well as I'm the Associate Dean for Partnerships and Outreach within our University of Virginia School of Nursing, and the Assistant Director for Partnerships and Outreach within our Comprehensive Cancer Center at the University of Virginia. Part of my work at the university and my overall program of research is focused on decision making, particularly among patients with chronic illnesses such as prostate cancer or breast cancer. And my overarching umbrella part of my research is looking at health equity, health disparities. One thing that I like to do, as well as others in the healthcare field, I think is important is really looking at to really have an active listening and listening to what was priority for that patient and then within their life, so that we can understand what are the realistic goals and not only for the patient, but also what's realistic for the healthcare provider as well, and what the expectations are. Particularly when nurses and physicians, they give information, we should also always kind of think about that health literacy aspect as well. How much does the patient understand health and is educated within health? As we all know, healthcare is quite complex in itself, and the different type of treatments and screenings and policy and so forth. So really giving that information during clinical visits in a simple, non-judgmental, and no to little medical jargon way is best. So that patients can truly understand what is really being stated to them during the visit, and then also when they go home, they can really say, oh yes, I did understand what went on during that clinical visit, and can be able to make an informed decision about any type of treatment or how they're planning on having their care. Oftentimes during thinking about trust and health literacy, we're really thinking about what type of tools and we can utilize and strategies and so forth. So we may utilize kind of like visual aids, such as pamphlets, diagrams, to be able to let the patient actually see what's maybe going on, to kind of give them some perspective. Also, again, speaking really plainly about the disease and about the treatment options and so forth is important, again, so that patients can truly understand what is actually going on and how to make a good decision for themselves. And no matter what the education of that patient may be, people may be highly educated in a certain topic, but not educated within healthcare. So really that plain language, talking really openly to each person and each visit is important when we think about health literacy. And just thinking about how can a patient be quite informed and be well versed within their own treatment and be a true partner in that driver's seat is important when I think about health literacy and trusting within a relationship between a nurse and a patient. Sometimes patients, they have a lot of resources that they can be able to look at and view and be able to talk to other individuals who may have had the disease kind of along the way, where there's others who may not have as many resources. So we had to be cognizant of what information do the patient have, how literate are they within their own health care, and then also how can we best help those individuals get to the point that they feel comfortable about, but also making sure that they have the best care possible. So we ask questions along the way, try to be present, be able to develop a good relationship with the patient in a welcoming environment, and so that the patient can feel comfortable in calling into the clinic to ask questions, even if they're not ready for their clinic visit, they can be able to ask questions along the way, so that we can gauge how much information do they have, how much resources do they have, and do they need other additional support in other ways. And that's why when the healthcare team can come into play, where individuals who may not have information about paying for certain medications, or may want to make certain decisions about certain treatment options, they can be able to call on different individuals within the support team and the healthcare team to help them along the way. I think a lot of patients and participants, they may have some confusion about what is a clinical trial, what is all involved and so forth. And also sometimes some people have a maybe a little bit have some issues with, being part of a clinical trial because they don't have this understanding. I think having a true understanding and conversation with your healthcare provider, the nurse, the physician, people of the team, to that individuals who are actually relaying the information about the clinical trial is important. I think that, and also the use of the terminology clinical trial. Some people kind of have an issue with clinical trial because oftentimes people hear clinical trial, the word trial may mean more of a judicial system versus about research. So sometimes we change the language of saying, would you be eligible, or would you want to participate in a research study, to kind of help people understand that it's not necessarily dealing with the judicial system, but maybe it's focused on actually research and focused on healthcare research. So being able to explain plainly what a clinical trial is, being able to explain clearly what is actually going to happen within the clinical trial, going over with a patient the consent forms that has been viewed and has been seen as a particular form that patients are going to be held and be kept at the most upright, important information, and given the most important information that is possible, so that they can really feel like, yes, I clearly understand what's going to happen in this clinical trial if I decide to participate. I think that's very important, and nurses, we play an important part in that. Oftentimes, study nurses, they provide the information to the patients so that the patients can truly understand what's involved within the clinical trial, and to be able to consent patients to clinical trials. And then also be able to go along the journey with the patient along the clinical trial as well, being able to deliver interventions and discuss openly, if there's any type of concerns, the participant can be able to call in and be able to ask questions and so forth. So active listening is important. It's an important concept when engaging patients for their treatment care as well as during clinical trials. When we talk about active listening, really trying to have an understanding of where the patient is, where their expectations are, really kind of having time to hear where the major concerns of that patient and where they want to prioritize within their life. Oftentimes, healthcare providers, they may do more talking versus listening, but it should be that we should be listening a lot more to the patient's concerns, so that once the patient's treatment has been completed, or once the patient leave that clinical visit, that the patient feel confident that their concerns have been met during that period of time, and that they have less regret, less decisional conflict, and so forth towards the end of treatment. So really kind of listening to what are those priorities, what are the major concerns of that patient, and being able to address those issues during the clinic visit or during the clinical trial or research study visit is important. Oftentimes too, even bringing in a caregiver or support person along with the patient, someone who the patient may trust, or the patient is really engaged with during their health within their health care, is important as well. So that way the whole team at home can be on the same page, and that they can be able to help make that decision or informed decision along with the patient. We know that many people don't live in isolation, so bringing in or asking the patient, do they have someone who they trust and who is helping them with their care, asking them if they would like to bring someone in, which would be fine, and then having those conversations. And again, sometimes having more listening ears is better for the patient, so that if things are maybe forgotten or other things need to be addressed, those can be addressed within a clinical visit, both with the patient and the support person.